Hello, my name is Olivia Fasano, and this is my prevention plan presentation on unintentional falls in elderly populations. So, unintentional falls are the second leading cause of unintentional injury deaths worldwide, and elderly people are most affected by these types of falls, specifically populations over the age of 65, and that becoming more intense over the age of 85. And this is a public health problem because of different reasons. Is obviously affecting one population more than others. The medical costs of unintentional falls are extremely high, and there is not enough being done to cater to this population specific to how things are designed or how people are treated in hospitals given with this population. So, looking at some literature from the past, um, some studies show approximately 1 in 10 falls result in serious injuries such as hip fracture, subdural hematoma, and other serious soft tissue injuries or even head injuries. So, with what we know, some research has shown some different types of prevention plans, some including screening elderly patients in doctors' offices about the history of their falls, and once a fall history has been assessed, then they do other factors to try to prevent further falls, and also try to figure out why those falls are happening, whether that's medications, mental illness, or situations uh, where the patient is at home either rushing or they have a bad home environment, and that's what they're trying to identify with that type of plan. Another study on preventing elderly falls was a similar approach, but they did conducting home-based interventions that focus on exercises that like help with balance, muscle strengthening. And so with these past studies, we want to propose a 4-phase intervention plan, and with each phase comes with significance with each one. So phase 1 would focus on modifying the environment and the engineering of homes in elderly populations, so 55 plus communities more specifically. This would be a primary prevention plan. So this would be where we would have policies made where houses in these communities accommodate to preventing falls, which would be handrails, seats and showers, ramps, lower standings, shelving, and cabinets. And so these modifications are minor, but they may show significant differences in the fall death rates or just even injury rates. Phase 2 of the plan would focus on training doctors similar to the past literature that we've seen. They would try to recognize patients over the age of 75 with pre-existing conditions that may result in future falls or maybe have already resulted in a fall. And with these screenings, we can create a course of action to prevent falls in the future. So that would be changing medication, reference to see therapists or a physical therapist, recommendation to a specialized exercise instructor, or exercise classes even. So this is a personalized method, but it's still a public health approach in the sense of educating health professionals and creating an effective plan to approach this issue. And then phase 3, this intervention would be a class provided at a local recreational center or community center near or within a 55 plus community. This class would specialize in strength, balance exercise, and also bring together community, different groups of people to be invited to come. And this class can also be offered within a home environment, so these instructions can be taken to a home. Either way, both methods focus on strengthening the subject to be resistant to future falls, whether or not they've fallen in the past before or they haven't yet. And then phase 4 being the one phase that we really don't want to get to, but we would still bring as a last resort option. This would be focusing on how technology can be useful once a fall has occurred. So this would be a tertiary prevention approach, but after a fall has occurred, it is important to effectively treat a patient post-fall to prevent further injury. So the technology involved would be like maybe a smart bracelet or smart necklace that can notify emergency services of a fall injury, and this can ensure that people who live alone, unsupervised, are able to access their services. And so this again that would serve as a last resort option for preventing injury, but these first three phases aim to prevent falls from occurring, so the need of this phase 4 should be not necessary to the success of the first three phases. So thank you for listening.